Clock, and joining us in studio this morning from Lovelace Regional Hospital, Dr. Sarah East back with us. Good morning, doctor.
Good. I am so happy to be here this morning because I have a couple procedures that I was wanting to discuss with you so that we can promote it to the patients and let them know that we offer these services here in Roswell.
Yeah, absolutely. For folks that aren't familiar, Dr. East.
Just call me Sarah. I'm a PA.
Sarah is the... I guess you could say the jack of all trades here with the primary care. So if you're got something going on and you're like, I don't know which specialist I'm supposed to, you go see the primary care. And if they can't take care of it, then they send you to the specialist you need here.
Exactly.
But a couple things we do want to talk about. And Sarah, one is, when we talk about migraines, and I don't know, I know a lot of people suffer from them. I don't know, when we talk about migraines real quick, what's the difference when we're just saying like a migraine versus I just got a headache? I mean, when does it officially go to migraine level status?
That's a great question. So a lot of people just suffer with regular headaches where they just have a little bit of a tension headache or a cluster headache. They're able to take just some over-the-counter anti-inflammatories and typically it goes away. Migraines are debilitating. So they cause you to have light sensitivity, sound sensitivity.
Okay.
You have to go into a dark room. It's really debilitating. Sometimes they can be nauseous.
Okay.
Severe migraines can even cause vomiting.
Okay.
So it's just the level of severity.
So if the pain's causing more than inconvenience, then it's probably more the migraine side. If you're getting nausea or dizziness or sensitivity to light, then odds are that you're suffering from a migraine.
Yes.
Gotcha. Okay.
Yes. And so, patients, they'll say, I get migraines occasionally. If you get one a month, or one every couple months, then we have just oral medications that will help take care of that. You take it at the onset of the migraine.
Okay.
It usually aborts it, and then if you need a second one, you can take a second one a couple hours later.
Okay.
But what we're doing is for those that have chronic migraines, at least 8 a month.
Okay.
Then there's oral medications that you can take on a daily basis to help minimize that.
Okay.
By the time the patients come to see me, they've already tried every oral medication
They've
there is.
exhausted all the pills and everything that they could take. Okay.
And so what we offer, and I've been doing it for several years now, but I just wanted to bring more awareness to the community, is therapeutic Botox for migraines.
Gotcha.
And it works tremendously on completely eliminating the migraines for the entire time that the Botox lasts, which is usually 3 months.
Okay.
And so at the end of every third month, sometimes patients will notice in that last week that the migraines are returning.
And
so then they come in and we do another session of it.
Okay.
Yes.
So really, in essence, instead of taking, your daily pill or take as needed, you could, in essence, get some Botox 4 times a year, basically, and that'll cover you all the time.
Yeah, completely eliminates it. People's quality of life really improve it to where they can work. They're not missing so many days of work, etc.
Now, correct me if I'm wrong on this, but because most people you hear Botox, we think of cosmetic surgery and things. But if I'm right, correct me if I'm wrong, but I believe Botox initially was for migraines, right? And then they found out that, oh, by the way, it also helps with wrinkles.
Yes. And actually, Botox does even more than just the migraines and the cosmetic side. So what we also are offering in our clinic now, which is something new, is for cervical dysplasia and also spasticity. So meaning if somebody has severe neck spasms to where their head is almost tilted or turned in like a chronic position like this because of their spasms, we can actually do Botox down the neck muscles to help relax that to where they can move their neck freely. And also for post-stroke patients that have chronic tightness in their arm or their hands are in a fist position, we're able to do Botox down the arm to be able to loosen up that to where their physical therapist can start moving their muscles a little bit in post-stroke patients. So Botox works on a lot of different reasons from the therapeutic standpoint as well as the cosmetic side.
Okay. So I'm trying, and this is where I'm like, my medical science is a little bad here. But so in essence, does Botox do something where, so like for a headache, does it allow the blood to flow or do something so where it releases tension and pressure there? Or,
no.
I mean, how does that science work there and work different, for muscles or
Yeah. So it works on the CGRP receptors, which are the receptors that trigger migraines.
Okay.
And so what it does is it actually blocks those receptors to basically help relax the muscles to where you're not getting the full-on migraine pain. And then from the cervical dystonia, same thing. It works on those to kind of, I don't want to use the word deaden the muscle, but for a lack of a better term, it deadens the muscle to where you're able to relax that muscle and it's not in tight spasm.
It's kind of like if you need a comparison, like when you're upset or tense and you kind of grit up and everything, and so that this allows that muscle to ungrit up and kind of loosen up so you can get in and you know, work it or whatever you got to do.
Yeah. And then from the next side, I wouldn't do Botox if, like, say you just woke up and you slept wrong just that day. It's not for that. It's for those with chronic dystonia to where they're like at a, you know, there's a term called torticollis that it's just where they're completely turned to a side.
Gotcha. So you're kind of stuck in that position, or it would cause a lot of pain to move out of that position or something like that.
And then, like I said, I have the reason why I also wanted to, you know, go through is because of the stroke patients.
Yeah.
You know, that's it. This Botox is going to help them tremendously because when they're in that chronic flex position of their arm and fist, it's painful. Like they experience pain with that because they're not able to ever move that arm because of the chronic spasm. Like just imagine being in a chronic spasm the whole time.
So in essence, it may allow some folks that weren't eligible or weren't responding to, say, rehab after stroke, they could start responding to some of the physical therapy and things that you got to do to get back to health.
Yeah.
Okay.
Yeah. Yeah. So the migraines is a huge thing. I have several patients that have been getting it now for several years, and their lives have completely turned around. They're not taking ibuprofen every day. They're not taking their oral meds that they used to take for the migraines. And they just come in. The procedure itself is maybe 10 minutes long.
Oh, wow.
And in and out, and their migraines are completely gone away during that whole time.
And I got to, because obviously the way that if they inject it, right? That's how they do that.
Yes.
For people that get squeamish.
It's a very, very tiny needle.
It's not that painful, and I'm sure it's far less painful than what you're experiencing with your migraine headache.
Exactly.
I think if you're going through that, you're like, I can handle a little bit of Botox.
It's a tiny little pinch is all it is. We go all the way around the head, down the neck, and into the upper shoulder area.
Okay.
And the worst spot that patients usually will make a comment on is just the forehead portion.
Okay.
But it's a tiny little sting, and I'm done within seconds.
Yeah, because there's not a lot of meat there, you know?
Exactly.
It's skin and bone mostly right there in the forehead, which is, by the way, the hardest part of your head, right there in your forehead. So if you call it hard-headed, odds are that it's not right there.
Yes. So it's exciting. You know, there was another provider that I was doing this with. He's unfortunately relocating, and so that's why I just wanted to let patients know, hey, I'm still here.
Okay.
I've still been doing them now at Lovelace, so I'm very excited about that.
Well, and good news, Matt informed me earlier here that the burritos are back. So if you want to make an appointment in the morning there, get there a few minutes early or stick around afterwards and have yourself a burrito and everything. Of course, you're at the remote but I'm trying.
You're trying. You just love the cafeteria. You love it so much.
I'm just trying to give people an excuse to eat a burrito.
Just tear the tortilla in half the carb.
That's true. That's right. You are going to see your doctor.
Yeah.
Let's also talk, obviously because of your practice, you kind of see everything and anything here, but also another part that you guys, your office treats and things is you wanted to talk a little bit about nerves and things like that, some of the procedures and things that you can offer for folks that are having nerve issues, right?
Yeah, so actually it's a very, very, very undertreated prevalent disease called overactive bladder.
Okay.
Men and women have it, and it's one of the symptoms is, hey, I have to go to the bathroom almost every hour during the day. I can't take long trips because I have to stop at every gas station along the way to go to the bathroom. If I sit through a movie, I miss half the movie because I have to run to the bathroom real quick. It's overactive bladder. It's also for urinary urgency. So if you have the urge to go to the bathroom, you have to physically run to the bathroom or else you're going to have a little bit of leakage.
It doesn't give you much lead up time. It's like It's either I got to go or I'm good. Yeah.
Yes. And so what I've been doing is this procedure called an axonic sacral nerve stimulator.
Okay.
And what it is we're basically rerouting the nerve signals to the brain to calm the frequent urination down.
Gotcha.
And so to kind of give you an idea, again, there's oral pills for this that patients start off with. However, there's a lot of side effects to them. So it can cause severe dry mouth. Everything's dry. It can make dementia worse. There's a lot of long-term negative consequences to the oral pills. So you got to really
weigh the options there.
Exactly.
That would be a funny bit of irony. It's like, well, I don't have to pee as much, but I get dry mouth, so I drink more water. Now I'm peeing.
Yes, exactly. And so, and the oral pills, to use an analogy, is kind of like a light. So if you see the light bulb flickering, you go and just change the light bulb. Well, if that doesn't help, then you start looking at the wiring to that light. And that's where this sacral nerve stimulator comes in, is that we're basically rerouting the wiring.
It's kind of like, and correct me if I'm wrong here, it's not that your bladder's full or whatever, it's what it is, but it's kind of like in a car where you got sensors telling you when you're low on gas or when the oil needs changing. Those sensors aren't working right.
Continuously going.
And in your body, that's your nerves and things, and they're giving false, dummy light indicators saying, you got to go to the bathroom. It's like you really don't. And so that's kind of where the issue is, and these pills help to, I guess, put them. Giving you correct information.
Yeah. So the oral meds just kind of, put a Band-Aid on it, essentially. Like I said, they're just changing the light bulb, but the problem is the wiring. So the procedure that I do is this nerve stimulator. And the great thing about it is that in my office, it's just a simple office procedure. We'll do a 3-day trial to where I'll put in this little tiny stimulator into your backside, and you wear it for 3 days. And almost immediately, within the first 24 hours, you'll notice that you're only having to go to the bathroom half the amount of times that you were doing it before. So we always have you keep what they call a bladder diary, or it also is for bowel incontinence as well. So you'll keep your bladder diary, and say you go to the restroom 16 times a day, 5 times at nighttime. The goal within the first 24 hours or even the first 3 days of the trial is to do only 8 times a day, instead of the 16.
Okay.
And so that trial is very simple. We'll do it on a Thursday. You come back in on Monday and remove it. And that weekend, patients will come to me and be like, my life has changed with this procedure because they were able to go shopping at Walmart and not have to use the public restroom.
I have a life to live without having to stop every 10 minutes to go to the bathroom. Yeah.
So once they do the trial, and if they are successful and they love it, then we send them for a permanent placement with a urologist who does it in a hospital setting. And again, it's a very simple procedure. They're in and out within that same day, and they go home. And really, the follow-up is just, hey, how are you doing? And they're living life, and it can last 15 to 20 years without having to do any maintenance to it.
So overall, for the results, it's pretty uninvasive for the most part.
Non-invasive.
Yeah, there you go, non-invasive.
Yeah.
That's why they pay her the big bucks.
Yeah. So I'm very excited about this overactive bladder. We were introduced to it about, I would say, 6 months ago to a year ago now. And but I haven't really done a whole lot of marketing on it. And so I really wanted to talk about that as well as the therapeutic Botox, just because these are things that we're not really treating. And
it sounds like, I imagine for folks that are suffering from this, they've probably tried multiple options, things, whether it's wearing the diapers or other things like that, and either finding it not convenient or embarrassing and things like that.
Because you smell of urine after a while, and they're having to change pads, and the pads are very expensive. Sometimes insurance doesn't cover them, and so that's where when we started doing this nerve stimulator, it just completely changes their life, because they may have had to buy 6 pads a day, whereas now maybe they'll use 1 or 2.
Sure.
And they're quality, like they're able to go to their granddaughter's wedding, things of that sort.
Yeah, confidence. I mean, it's that one's probably as much a condition of the psyche as it is a physical condition, because at the end of the day, you're looking, it's a minor inconvenience in the big scope of life, but socially or it's not, and that's where I'm And I'm guessing people that go through that probably also start at some points suffering from other ancillary depression and various other social issues and things like that. So,
Yes.
so yeah, sometimes a treatment like this could be the difference between a life of happiness versus one of suffering.
Yes. And with once you get the permanent, there's two types of permanents that Axonics offers, and one is rechargeable and one's non-rechargeable. The rechargeable is still the mainstay one, and all it is for an hour, like every 2 weeks, because you'll have a little permanent stimulator in the backside, and you just place this little charger over it for about an hour every 2 weeks. And so it's very, very small, very convenient. And then they came out with the non-rechargeable kind to where you don't even have to do that. But you have to realize, a battery life on the rechargeable can be up to 20 years, whereas the non-rechargeable is maybe about 15 years.
So you're going to have to replace it more often.
Yeah, it's still 15 years.
That's a long time,
10 to 15 years, yeah. So either way, there's pros and cons. But the company is amazing. They do the full workup as far as the Bladder Diary, talk to the patients, say during that 3-day trial, they're checking in with the patients every day just to say, hey, any concerns? How are you doing? How many times did you urinate? Keep track of that. And so it works really, really well here.
Interesting. So if folks are just learning about this or dealing with some of these issues or have been for a while and they're kind of wanting or hoping for an alternative here, schedule appointment with Sarah here and let's talk about it. Let's see if you're a great candidate for this. Maybe this is the perfect treatment for you. If not, then maybe there's some other options that Sarah can help you in the meantime. And I imagine, like you said, that procedure is, after trying a bunch of things first. That's not the first course for someone coming in the first time saying I'm suffering from incontinence. Some of these
usually we'll just have to try at least one oral medication. So as long as you've tried one oral medication, that's pretty much all it takes for insurance to approve for you to get the trial at least.
Okay.
Yeah.
Very good.
Yeah.
And I'm sure you've dealt enough with insurance that you can help, finagle and say, all right, this is probably the direction they're going to lean. So we're going to go with this style of treatment or something like that.
I call it the insurance game. We definitely know how to play it. In fact, I feel like I'm a master insurance gamer.
and that's important too, because when you want to be treated, there is that, your healthcare professional is going to, obviously he's the expert in the room and that's who you want making those decisions. But sometimes insurance companies can finagle and fight with it. And so for you to be able to say, okay, well, they're not going to go this way, but I can do what I want this way just as effectively, or no, I need to fight your insurance and say, this is what we got to do.
Yes.
And,
exactly.
and that's, and it's nice to know that, hey, you got that experience. And because I think in this day and age of being a healthcare professional, you almost have to have that ability as much as the ability to treat a patient.
Exactly. Yeah. Yes. And so that's why, it's one of those things that I know the general requirements for each of these procedures, the Botox for migraines, the neck spasms, the arm spasms, and then now the overactive bladder, the urgency. So, once you kind of have a good game plan with the patient, you guys are all wanting to have the same endpoint of these procedures, then we know how to do the paperwork side of it.
Absolutely. Now, of course, if you're not suffering from any of these issues, but you have other issues as well, Sarah can handle that. She's a primary care provider. So what that means is whether you stub your toe or break your leg or feeling sick to your stomach, whatever it is, she can be the first line of defense for you and either treat it or get you to the expert that can.
Yes, exactly.
Best way is if you want to talk about Botox here, or if you want to talk about this procedure for incontinence or anything, you can call Sarah's office, schedule an appointment direct. You don't have to go through the gauntlet or through another provider. Just call direct, 575-627-4200. Again, that's 575-627-4200. Or you can swing by her office. Like I said, she's not at the hospital. She's there at 1112 North Main Street, at the Lovelace Healthcare Center there on North Main. So,
correct. Yep. Yeah. And I was going to say, if somebody has their own primary care and they just want to be evaluated for this procedure, all they need is just a referral from their primary care to me for the procedures.
Okay.
And I'd be more than happy to go ahead and take care of them with just either if it's the migraines, the post-stroke patients, the overactive bladder, and they're able to keep their primary care as well.
Now I'm just curious, if I don't have headaches, but what if I want smoother skin? Can you Botox me there too? Or
That's my side business.
Okay.
Yeah. I do the cosmetic on the side.
Okay, I was curious about that because I was like, I'm just thinking, I don't have headaches, but I do look like an old man.
Yeah. I can make you real pretty too, Mike. Yeah, that'll be after hours though. That's the side business.
Gotcha. But if you're having any issues on anything here, it doesn't matter what. Sarah can help you with all of that. Please schedule an appointment. If you're looking for a regular, full-time provider for your family, Sarah can help with that.
That's where I'm at.
That's the jack of all trades. That's kind of the. I'm curious for you. Is that more fun to practice because I imagine if you're a person that likes to solve things, you like that kind of adventurous side a little bit. I think if you're a doctor or in medicine and healthcare, you got to go family practice or primary because you literally don't know what you're going to. I mean, you have an idea, but you could see anything on a given day, whereas a specialist, odds are, okay, it might be different conditions, but it's all going to be heart related or it's all going to be. I mean, for you, is that kind of part of the fun of being a provider?
Makes it fun. Yeah, this makes it fun because I like the procedure side.
Yeah.
So, I do all joint injections. I do nerve blocks. I've incorporated the Botox into my practice, the Overactive Bladder Stimulator into my practice. I like to see how much can I do in the office to where most patients in general always sent out to specialists.
Gotcha. You're like, hey, can I get it all done in my office right here?
How much can I do here to where, we're rural. Yeah. Whereas if you're in Dallas, everybody that does this procedure are all going straight to the urology for it.
Yeah.
Whereas primary cares there don't do it a whole lot, but they don't need to because you can get in with a urology. There are a dime a dozen in Dallas, whereas here we have one. And so to kind of help them out, I at least do the trial in the office, and then the permits can be placed with urology.
Gotcha.
Yeah.
So really, it's just fun because you get to.
Yeah.
Because really, you're right. It's kind of, I have an image of and this is where I'm a little older, but the old Looney Tunes cartoons, like the assembly line, dun, 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 they're stamping stuff. I feel like that in some cases can be healthcare in larger cities like Dallas and things like that, where dun, 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 it's a stamping. Where here it's kind of not like. I was going to say Doc Hollywood, another 90s movie reference, but it's not like that where he's jumping from house to house. But at the same time, it's more like that, and you get to know your patients. You see them on a regular basis. I'm sure you have, you talk to them about their lives and everything. You see them, especially your patients that are in frequently. You're as involved in their lives as probably some of their family members.
Yes,
and so
exactly.
You get the chance to meet them and talk with them and learn about their families. And
I've been here for 13 years, and so I've have patients that have literally been seeing me for 13 years. So it's a great thing.
You've got your loyal patients that have been with you for 13 years, and they've been with you that whole time. So you can do that too. Again, you can reach to her office direct, 575-627-4200. Again, that's 575-627-4200. Stop her office, 1112 North Main, there at the Lovelace Healthcare Center there on North Main. Yeah. And definitely, and even if you're not suffering from migraines or anything, you just, like I said, you need a healthcare provider, and maybe you're a family just starting out, getting together, and you're like, all right, we need to pick our doctor and all of that kind of stuff. Yeah. Sarah can help you with all of that stuff.
Yeah, it's fun, and I'm all about preventive medicine as well. So at least once a year, everybody should be having a checkup for their basic labs, make sure everything is going okay, and their annual checkups are very, very well advised.
Do you see a lot of patients that, obviously, folks that have diabetes and things have their endocrinologist specialist and stuff, but generally speaking, you're usually the one that kind of monitors their, checking their labs every several months, making sure everything's going, and adjusting meds as needed and things like that.
Blood pressure, cholesterol, diabetes, all together.
All the big ones, all the ones that most people come in on a day-to-day basis to see you for. So very good. Yeah. Sarah, is there anything we missed? Anything we wanted to share? Any information that we wanted to cover that we just got sidetracked on?
No, actually, it's just really letting patients know that, hey, if you're suffering from migraines, this is another option for you. You don't have to be taking, 200 ibuprofens every month and going from there. So I really wanted to say that you don't have to live with migraines.
And I think there's only like, isn't there X amount of milligrams of ibuprofen a day you can take before you start doing damage to your body?
Well, not only that, it can cause GI bleeds. It can cause kidney failure. So there's a lot of negative downturn to ibuprofen.
I'm not saying it, ibuprofen is a good thing at sometimes, but if you're relying on it and taking it on a daily basis constantly, you might be doing more harm to your body than help at that point. So please talk to Sarah here and let's get you off that and get you into something that's actually going to help you.
Yes.
So.
Yeah.
Good deal.
Yeah.
Well, thank you, ma'am.
Thank you, Mike. I appreciate it.
Make Matt get you a burrito on the way back to the office.
I know. I'm gonna tell him to bring me some food from the cafeteria.
See, that would have been a state. See, I would have held out. I said, "You want me back? You gonna put me in the hospital so I can be near the burritos all the time?"
That's so funny.
Thank you.
All right,
appreciate
thanks,
it.
Mike.
Have a good one.
It.
Don't work too hard. All right. It is